Dementia and dysphagia. Let's talk about it. In dementia and other progressive cognitive disorders, now that's with a caveat because there's a lot of different types of dementias, but we'll get into that in future videos. The main drivers of dysphagia are a mix of motor, sensory, and cognitive changes. Things could include delayed oral processing, unsafe self-feeding, silent aspiration. Those are the most common. The clinical focus often shifts from cure to safety, comfort, and preserving meaningful oral intake, so enhancing ease, comfort, and enjoyment during eating and drinking. A general practical approach is to prioritize a safe feeding and eating environment and feeding routines. So focusing on a calm environment, one-on-one feeding if it's needed, and simple visual cues. Caregiver training and texture adjustments may be needed as well. Restorative exercises may be attempted, but only with patients who can reliably follow commands and tolerate practice. Otherwise, they often just add burden without benefit. It's important to document goals early, especially as the priority of comfort and pleasure of eating changes over. It's also really important to work with the individual and their loved ones, as well as the care team, to determine goals of care. We know that swallowing changes are going to happen as diseases progress and cognition changes, so it's important to be prepared to transition to more adaptive-based plans when it's required. In terms of dysphagia management in these populations, often what matters is really trying to preserve that quality of life. We want to enhance safety as much as possible, yes, but what is also going to enhance quality of life? Are there certain foods that we can modify to make them a little bit easier and safer for that patient to consume? For example, if a person particularly likes sweets, candies, things like that, what candies are going to be safer than others? So for example, let's compare a Twix bar to a York peppermint patty. Those are completely different texturally. A Twix bar has that cookie bottom, and they're difficult to chew. They're difficult in general, and that can really impact someone's swallowing safety. Versus a York peppermint patty, or maybe a Hershey's that someone melts in their mouth, is going to be a much safer alternative because we don't need to chew that a whole lot for it to go down the tube nice and easy. We'll get a lot more into this in future videos as well, but I wanted to generally cover that with dementia and other progressive neurological changes, the goal is often quality of life and enhancing safety as much as possible while balancing that ease, comfort, and enjoyment with oral intake. For more educational content from the beginning to the end of life.